Next step is to talk about all the different trocars and cannulas and everything else, because it's important to know how these things are put together in order to be able to clean them. This is a spay hook. We use this to go through the abdominal wall in order to tent up the ovary. This just needs standard cleaning like any surgical instrument. It's sharp, so be careful. Next are the trocars, and the 11mm and the 5mm trocars are built slightly differently, but we'll go through it. The basic principle is that it is a hollow tube through which a very sharp implement can be put through. This will be forced through the abdominal wall, the trocar comes out, and then that allows us to put stuff through it. That port there is for carbon dioxide to go through. Okay, so that's the basic anatomy of this thing. Now, how do you clean it? How does it come apart? Each bit will come apart in different ways. So the bottom simply unscrews, and then that can be cleaned with a brush. Scrub down. It can probably go through the descaler, but I'm not sure about the other pieces. So at the moment we haven't been putting anything through the descaler. This top bit unscrews. So again, that can be cleaned separately. Bung comes off. You'll be surprised to find where fat and blood actually comes out, or where blood gets into, so this needs to be taken apart completely each and every time to make sure it's cleaned. And then obviously this gets cleaned, and just be aware there's a little trapdoor there that needs to be opened up, and everything needs to be cleaned. So that is the 11mm trocar. The 5mm is similar but a little bit different, and it's just got a couple of extra pieces. So again, there's the trocar that goes through, bottom bit unscrews, can be cleaned. You've got a middle bit now, can be unscrewed and cleaned. Then this bit here divides into two. That needs to be cleaned. That needs to be cleaned. Basically take it apart. It's really important that all of these rubber seals are maintained. Just be careful with them. When you're putting stuff back together, make sure everything's lined up perfectly. It's screwed on gently. It's not forced on. Don't put too much force, because what we don't want to do is damage any of these seals, because then it's a real pain, because you've got CO2 leaking. If CO2 leaks out too quickly, then the abdomen will deflate, and then I can't do the surgery. So it's quite annoying. So again, as this goes on, just after you've cleaned it, just gently do it until it's finger tight, and that's fine. And you can put it all back together once it's all dry. This is a fresh needle. We very, very rarely use this, but again, I mean, all these things, they just all come apart in various ways. So you just make sure it's clean. Just be sensible. So that's that. This here is just a little bung. If we've got the large port in there, and we need to put, if we've got an 11mm port in there, and we want to put a 5mm instrument through it, that's a little transducer. So it allows us to go through without having any leakage of CO2. So now we go on to the hand pieces, and again, these all need to be taken apart to be cleaned. First thing we do when you're taking these things apart is make sure that the head bit is closed. Some of these have a ratchet, and some of these don't. So that's got a ratchet, this doesn't. Generally, it's only the scissors that we would use that we wouldn't use the ratchet on. The setup is exactly the same though. So this little bit here unscrews, and that loosens off. You now need to open it up, and as you open it up, you'll see that this inner bit comes out and allows you to unhook the handle from the unit. So again, if you're putting this back together, just make sure it's opened. That gets slotted in. Close it, and that screws back on. So this piece number one comes off. This is really annoying because it's not completely attached, so be aware of that. You're putting them together, everything's sterile, and all of a sudden this falls on the floor. It's really annoying. So put that down, and then this comes off literally just by unscrewing that. Step one. So that needs to be cleaned. I don't think this comes apart any further, so that's just that. So 1, 2, 3, and then 4 just to secure it all together. And then again, if you look at the scissors, it's the exact same setup. So just unscrew, open, take this off so it doesn't fall on the floor, and unscrew that. And obviously these are all interchangeable, so they're all made so that different shafts can be used with the different handles, etc, etc. So that's all nice and easy. And it gets easy, and then it gets a bit more complicated. So this is the vessel sealing system, or the vessel sealing handpiece that goes with this system. The whole idea of this is that we can pinch pieces of tissue, seal them with electricity, and then there's a blade that can come through, so it's nice and efficient. We don't need to seal something, then come out and then snip it with the scissors. But the handpiece is a little bit complicated, so we'll go through this in a separate video. That's what that is. Finally, just the scope and the setup here. We've already been through it in the initial setup. We've got a camera that fits onto a scope. Just down on the floor. And then when you're cleaning the scope, you just need to be aware that this piece comes off. So when you're cleaning it, make sure that that there is unscrewed. This outer bit comes off as well. So make sure that those pieces are taken apart, cleaned, and then put back together. It's rare that this gets very mucky, but it can, so as general maintenance this should be taken apart, and then this is basically just wiped clean. That's basically it. Cheers.